So on February 15, 2013, when I went for my appointment at 1 p.m., it's the three-story office building, and Capital Imaging is in the basement, and they operate there 5 days a week. But the Dr. Jacobson's neurology practice is only operating upstairs 1 day a week. His Maryland practice is just like a sham set up to send his DC patients over there. So anyway, the physicians now. And all doctors know all these things, right? When they see these facts, they know all these things. They can look at one fact and they can understand everything, right? So really, because I'm not a physician, but a physician will understand all these things easily. And a physician also knows the landscape about the who's who in the DC area, and they'll know exactly what happened and who did what. So they know all the details with very little information, right? They don't need much. They can know all the rest. So they know. Now in this case, there was a physician's assistant, right? So it looks like Dr. Jacobson has a physician's assistant. She's a woman in her 30s, she was on the attractive side. So anyway, but she's down there at the MRI facility, and if someone is like a medical assistant and she's in her 30s, and in the DC job market of today, you could say she's somewhat of a dummy, because really nobody picks that for a career path. So even though she's fully immersed in all of Dr. Jacobson's frauds, and she makes money off of Dr. Jacobson's frauds, but still, originally, she just got into the job as a regular old medical assistant. And if you are at that young age and you're in the DC area, if you choose that for a career path, and you're from the US, you haven't come from some other country or anything, you're a dummy. Okay, so, and it looks like she's the same person that some of the patients mentioned, that when they call Dr. Jacobson's office, when they do the back surgeries and it really harms them, right? And this person gives them the runaround. So this dummy does not even have any skills in the legitimate job market, but Dr. Jacobson trained her to do some bad things. So this dummy may be something of a confidant. This dummy would be sent from the neurology office to the MRI office to wait for me. And just like some produce buyer or such, this dummy would check me out and rush back to Dr. Jacobson's office to report if I am what Dr. Jacobson is looking for. There is also another woman, Michelle Miller, also in her 30s, and she's probably even more of a dummy. She's only a receptionist. She's not even a medical assistant, and she works for Capital Imaging, and the work consists of maybe only a few phone calls per day. Of course, she's also a part of all the schemes. But these are all money, fraud schemes, but of course people get hurt as well. But she's not someone who's around Dr. Jacobson all the time. So although she could have checked me out and just phoned Dr. Jacobson upstairs, Dr. Jacobson relied on the woman who's with him 5 days a week. So Mr. Papel, now what the black box from the MRI test shows that the contrast injection never failed. Right, Mr. Papel did eight sequences without contrast. Then he put the contrast in and sequence 9 worked just fine. But what he did after sequence 9 is he lied to me and told me that the injection failed. Now he could not have done sequence 9 without the injection had the injection failed. So instead of just finishing off he only had two more sequences, just two more sets of images, sequence 10 and 11. But he takes 9.5 minutes and he sets up the catheter on the back of my left hand. And he's very nervous the entire time, because if you think about it, he's basically doing something like making a half-court shot in basketball, you know. He's been training all week, and he's really nervous now, and he's got to make this big shot, because if he messes up, he can't do it again, right? Because if he strikes a nerve or something, he can't do it again. So, and everyone knows if you, now, so what he would do is, he would establish the catheter, and then he goes ahead and does the sequence 10. Then he again gets me out, and then he makes some final adjustments for a minute and a half, and this is all showing up on the data recording. And then he also attaches an extension line, and then he gets me back in and he does sequence 11. So sequence 11 is the final one. So basically the full MRI test gets completed, and that's the time while I'm inside the tube, Dr. Jacobson, the expert surgeon, see, I thought at first that this ragamuffin looking MRI tech guy did all this little monkey. But this little monkey doesn't have the capability. So it was the expert surgeon, Dr. Jacobson, the neurosurgeon, who, you know, the trauma surgeon, who's very comfortable with all of the life and death motions of the human body and recognizes all of these things. He's the guy who, and so I didn't know that. While I was in the tube, he entered into the room, and then he administered the actual injection. And what he did is he flushed. It was set up. He flushed a large quantity of water through the ulnar artery in the back of the left hand, and he flushed it in reverse all the way up to the brain. Now, you know, with the intravenous injections, if you inject the vein, it goes into the heart and that distributes things to the whole body. But when he sent it through the artery, it's going in reverse. So, and when the artery goes in reverse from the back of the left hand, one half of it goes back to the heart, but the other half, there is an outlet where it goes up to the brain, right? Because what happens is from the heart, see, from the heart, the artery system coming from the heart, it's one tube, okay? And that tube has a tube coming out of it which goes up to the brain. Actually, it has more than one tube. It has two tubes coming out of that main artery going up to the brain, and then it has another tube coming down to the arm. Okay, so what happens is when you flush water up in reverse, it goes up into both those tubes back to the heart and also into the brain. So what he did is he used that to flush the blood out of the brain, which means he's getting the oxygen out of the brain and the person becomes unconscious. So only this doctor, but then he has to maintain this state. So what happens is Dr. Jacobson, along with Dr. Cochran, the head of the practice from Innova, along with these two dummy women from this from this office building, along with other people from their office, and I think the only other person they have is someone named Patrick Jackson, who was recently convicted of defrauding physicians and veterinarians. And then we don't know who else. This is why I call it Deliverance on the Potomac. I don't even know who all were involved, but all these people together committed a sexual assault. And so, and after the sexual assault, the phase 2 is even worse than phase 1. To conceal all this, because I'm going to have some, because after that, what they did is I'm going to have some injuries in my arteries and internally up to my aorta, right? So I already, because of what they did by flushing the water up into the head, I have swellings on my face. I already have then an aneurysm formed on the ascending aorta coming out of the heart, because it's really going in two sides. It's going to the brain and it's also going to the heart. So with all these injuries, and to cover up, what the plan was, what Dr. Jacobson did is he would use that same process again after the sex assault. But this time he was out to cause a stroke. So this means the brain cells dying from the lack of blood. This causes physical and mental incapacitation and loss of all functions. Consequently, I would not be able to prosecute action. Truly a fate worse than death. Now, stroke is a common medical ailment, but when produced deliberately, it is also equal to the most severe criminal offenses. And that list would start with first-degree assault. So, because Dr. Jacobson is a neurologist, and Suburban Hospital, where he runs that unlawful back surgery mill, which is very profitable to the hospital, and the hospital is just down the street, so he would have no difficulty in controlling the facts. And I did not have a family doctor, and so Dr. Kulkarni, the neurologist, was my only physician, and Dr. Kulkarni would just second the false opinions of Dr. Jacobson. Now, on the face of things, it would appear that I was very fortunate. The rules from Medicare, which apply to even non-Medicare patients such as myself, is because there is a minute possibility of an allergic reaction or kidney problems when contrast injection is administered. There has to be a pre-standing agreement with the physician in the building, and this can be any physician, even one completely unrelated to or never even having been inside the MRI facility. The physician just has to act as a good Samaritan in case the allergic reaction or the kidney problems come. So what would happen here is it would so happen that the Good Samaritan is a neurologist, a specialist in strokes, and my physician is also a neurologist. So basically it would appear that I was at the best place to suffer a coincidental stroke, and they would take care of my health. But